Well, it's great to be here this morning, particularly with people who believe that government has a role in the lives of the people in this state and in this country. And that's something that we have to remind some folks who think it has no role until it's about their highway or their now school district, which is a good thing, or their friend who needs a subsidy for their corporation. That person, that's the corporation. What's great is that after 2003, when the most devastating cuts were done to mental health, and I want to take some people back to that time, because I don't think people realize what actually happened. First of all, the general revenue dollars that go to the different counties and centers was cut by over $100 million. Second of all, in the CHIP program, if you will remember, the bill that was passed in 2003 eliminated mental health services in CHIP. And under Medicaid, the counseling services for people who were eligible in Medicaid for mental health services was cut. Actually, what happened was you couldn't get services from an MSW or a doctorate in psychology, an LPC, whoever the case was, but you could get med management from a psychiatrist. But essentially, we're talking about mostly elderly people, quite frankly, who would fall in that category if it wasn't children, and some would be disabled. And so it was the most massive cut that anybody had ever seen in mental health care. Now, prior to that, Leticia and I and others, we worked, actually got us from 49th to 43rd in the decade of the 90s, in the early decade of the turn of the century. And then we did the slide back to 51st, all based on those cuts in 2003. It's important to talk about this because we didn't have to make those cuts. And that is why this training is good, to understand when someone's saying, well, we don't have any money. Yes, you do. You're not telling the truth. And I'm going to tell you why we had money. The stimulus that we hear talked about, that's just such a bad thing, included federal fiscal relief. Now, that wasn't the first time federal fiscal relief had been done for all 50 states. Governor Bush, then President Bush, did federal fiscal relief in 2003. That federal fiscal relief sent $650 million to the state of Texas for health and human services, cash, that could be used to match other federal funds. So what that meant was, if you matched it appropriately, you didn't have to cut CHIP, you didn't have to cut Medicaid to the bone or get rid of those services in Medicaid. And not only that, we had money from the enhanced Medicaid match rate. That meant we had to use less general revenue to cover the general Medicaid population. So when someone says, well, there were $10 billion we needed to find and there was the need to cut all that, the answer is no, there wasn't. The $650 million cash was never appropriated in 2003, although it came into every state. It sat in the Treasury till 2005, and some of it was used then, and it sat in the Treasury some more till 2007. Now, this is what happens when people hide the ball. Like I said, we had plenty of money. It wasn't even a problem. And the other thing, in 2003 and 2005, people swear we never used the rainy day fund. Well, we did. It was part of the budget process in 03 and again in 05 and a little bit in 07. But when we get to 09 and 2011, can't touch the rainy day fund to keep things whole. What's great is that there are people who believe that we should make our way back to a better appropriation of dollars for people with mental illness. Because one of the challenges is there are people with mental illness, and you know there's a gap. They're not sick enough to be disabled, but they're sick enough to not work. And those individuals who are the ones that depend on the state appropriation and the local appropriation for dollars for treatment. And what our population has grown, but our money is stagnant. We've put some of it back, the legislatures put some of it back, but the population has grown faster than putting the money back. When that money was originally cut in 2003, that's almost 10 years ago, folks. And we're not back to the amount of money that we spent in 2011 or 2010. That's why we dropped below the District of Columbia. Because the best trick is to keep the funding stagnant as the population grows. And then there's less and less money to serve the need, and Texas population continues to grow. So that means the number of people that can be served from those dollars continues to shrink. But it doesn't look like a cut. The way we budgeted before is we dealt with something called the current budget, services from the current budget, and then if the number of people grew, caseload grows, and inflation, then we'd add that to the budget and make sure that all of those individuals were covered. But we never cut below current services. Well, that has been very different since 2003. So basically in our budget, there's a stagnation when it comes to the funding for different services, which means that's a progressive cut as time goes by. So how do you catch up 10 years of spending? People say, God, they go to those tax and spend people again. They want to catch up with 10 years of spending cuts. Well, there are 10 years of people who had a need that aren't getting it. And that's what's important. Next session. Leticia did a bill last session, the suicide prevention bill that links with the bullying bill and does a watch on children whose behavior has changed, probably for the worse, to make sure that information gets to the parents. So it's more than just the person that has been bullied. It's any change that can be identified, and then information about that gets to the parents. But it does dovetail with that bill. The bullying bill is a great bill, but it's a disciplinary bill, whereas this bill has to do with intervention for all of the students that might be in trouble because of that circumstance, or just having what students have. Some aren't identified until they're because of it. So it goes like this: they're with the teachers and the people at school more than they're with us. And that's just the truth of the matter. You can count the hours, and it's just true. So that was great, and it was a fight. As usual, things are a fight, but we got it passed, and I have to thank, what's the lady's name? She's retiring from the Senate. Shapiro. And Miss that's right. And Miss Mosbacher went around with letters. Y'all may have heard of this guy Mosbacher, who used to be Secretary of Commerce under the George Herbert Walker Bush administration, and this is his widow. And she helped a great deal on that by writing personal letters and handing them to senators personally. So that was wonderful. But that just shows some things can happen if you have enough people who care. So that was, I think, probably part of the big stuff. I also want to talk about John Davis, and I think it's very important to talk about him. John Davis is a very conscientious member of the legislature, and he made it a personal mission to restore funds to the mental health line in the budget of the state of Texas. And without him, I don't believe there would have been as much effort done to put money back. And he used a lot, if not all, of his capital We all helped, but it was John who really worked hard on those issues. Okay, next session, and it just goes without saying. There's one thing only that we have to do that makes a difference in the lives of people with mental illness, and that's do the Medicaid expansion. Because it's already predicted that if Texas does the Medicaid expansion under the Affordable Care Act, then from anywhere from 80 to 95% of those individuals who are not eligible for Medicaid now would be eligible for Medicaid with the mental illness and be covered. I'll say that again. This is a really big deal. Those individuals, because they probably don't have any money, they'll be under 133% of poverty, they would then have Medicaid coverage for the first time. The mistake is that people believe Medicaid covers mental illness. It doesn't. It covers people who are deemed disabled and have a mental illness, which you know is not easy. Because if somebody has a mental illness and has an alcohol problem because they're self-medicating, when you go to court and try to be deemed disabled, they say, well, no, you have an alcohol problem, not a mental health problem. So that it's very, very difficult. So now those individuals will have an opportunity to have coverage like anyone else to see the providers that they need. But as you know, the Supreme Court decided that because of pulling money from regular Medicaid as opposed to just penalizing the Affordable Care Act, that it was optional for states to expand the Medicaid population of adults. So this next session, people need to make the case, I believe, that this is how you serve people who are unserved now. And this is a 90-10, it starts off 3 years, 100% of the funding comes from the federal government. 100%. And then the years after that, it's 90-10. We talked about how good the CHIP match was. Oh, this is the same match as the Women's Health Services waiver. 90-10. And so it makes a difference, particularly because adults are where we lack any opportunity for treatment. Yes, it's bad, and children will be eligible if they're Medicaid eligible. Yes, it is bad that we treat children's mental illness in the criminal justice system and that we treat adult mental illness in the criminal justice system and that there's less capacity. Well, with this change, there'll be a whole lot more capacity for everybody because there'll be funding for people who we're now paying for with only state dollars. And so that expands the pie, which means a hospital can stay open because they have to have patients who pay to stay open. And that's just the long and short of it. Menninger ain't free. And they don't even take insurance sometimes. They want you to have to be able to pay for the whole time ahead of time. So if you're going to do 30 days, you have to give them $30,000 or more. So that's something that if someone were to say what was the main issue for health care in general and health coverage, but for mental illness in particular, it would be the Medicaid expansion. The benefit is greatest to people with mental illness, period. And the benefit is greatest to Texans from the Affordable Care Act because we have these dismal numbers. So those same people that we talked about that make us 51st, the Medicaid expansion will take us up a great deal because we have the greatest need. The last piece, give back some time, the last piece is currently going on, which will roll over into the next session, and that's the 1115 waiver that was passed in the budget last session. And I put a few things in there that pertain to mental illness and that mental illness be funded under that waiver. And it looked like an insurance plan. And so this idea of the authorities and that, and then, the hospital districts, that actually can blend differently now. And if we get the expansion, it becomes an insurance program that allows people to get what they need. I've met with several people that people who run the mental health authorities, the MHMRAs in different big cities, and they understand that the world is changing. The only thing I said is, let us know how much money you need in order to serve the people who would not be covered under these scenarios, so that there is enough money to cover anybody who does not qualify for different programs. And so we're still working on that. But the number of people who will be covered, just think about it, it's $29 billion over 5 years. That's a lot of money. I don't care what anybody says. It's a lot of money. Lastly, our County Affairs did an interim study 2 years ago, and we're looking at some of the things again, but we looked at the mental health system, we looked at the jails and the cost to the jails. And counties support this waiver because it does divert people from jail, and the mentally ill being a part of the census of that county jail. But they support it because it diverts people into treatment, and there's money for it. And that's important. And Leticia mentioned their program, Haven for Hope, in Bexar County. It is the best. That is the model that other counties should be following in terms of dealing with diverting people to the appropriate treatment. That's how we'll deal with mental illness, at least for those who have no place to go. They can now be diverted into the programs that are put together by the 1115 waiver dollars. So I'm going to stop there. There's many more things that can be done next session. That's clear. But the most important for people with any illness, but particularly for people with mental illness, is that we do the Medicaid expansion under the Affordable Care Act. Thanks.